A very good morning to everyone who is tuning into this morning session. We're very happy to be here with all of you, whoever is tuning in from all parts of the world. And just want to introduce our very first speaker today. Now, this cancer concept, rather the cancer care concept, has been initiated by Dr. Mariam and pulling everybody coming in together and Huisin being a very experienced dietitian. More will be shared later on about her, and myself, a movement therapist, specifically in somatic work. So Doc has been in this business for 15 years in research experience in cancer drug discovery and with medical plants in 3 different countries from Singapore, Malaysia, and Sweden. So currently, she's also a super mom of three preschoolers, right? Age 2, 4, and 6. Very even. As you can see, she plans very well, right? So having had personal encounters with cancer within her close circle of family and friends, now she feels the need to translate and share this knowledge about cancer from the lab right to the public. And that's why we are doing this for everyone today. And as excited as I am, there's a lot of emotions going on too because I personally lost my mom to the tumor. But maybe more of that next time. So Mariam incorporated wellness with Dr. Mariam with a focus to educate and promote total body and mind wellness. I think Dr. Mariam will kick off our session today on what is cancer and how to prevent it. It is a lifestyle approach. So do take it away, Dr. Mariam.
Okay, thank you so much, Vincent. Thank you so much for the very kind introduction. I'm really happy that we are able to get together. And as we go along, I think that you will get the significance of this collaboration that we have between the three of us. And before I start, I would just like to do a disclaimer. The content of this presentation is for informational and educational purposes only. Okay, they are not intended as substitute for a medical advice of a physician. So please consult your doctor before embarking on any health programs. Okay, so just a bit of background on what I did and in what is this cancer drug discovery research that I was doing. Okay, so I started off doing biochemistry for my bachelor's, and biochemistry basically I was studying what are the biochemical processes that happens in the body. And actually you see this chart here. This is just part one of the biochemical pathway. There's two parts of it. And you see everything is so tiny. So over that 3 years, I was studying like portions of this pathway to understand how our body function at the micro level. And then after that, I was very interested about herbal medicine, traditional medicine. And so I got the opportunity, okay, to study drug discovery from medicinal plants in Malaysia. And in that study, what I did was uh, I collected plants from the forest, extracted the components, and then we isolate them based on the biochemical activities. And I was doing the screening against cancer cells. So that's where my experience in the cancer drug discovery started, because I was identifying plants or molecules from plants that can have a cytostatic or cytotoxic effect. And then, of course, we go on to identify the structure of these components. And from there, other people in the lab would develop analogs so that they can improve the activity of these drugs. And then after I completed my master's, I was really curious. Okay, now I know how drugs are made, but how do drugs work in the body? And that is where it took me to my next adventure. Okay, when I was doing PhD in Karolinska Institute in Sweden. And I got the opportunity to study in depth the processes that happen in the body in relation to cancer when we apply drugs to it. So this was a combination of what I studied in my bachelor's and in my master's. And it's for me, it's really satisfying to get to go through this whole process, this whole journey. So although my PhD, it was focused on a couple of major genes, but through that experience, I get to understand the significance and how we analyze how the drug works in the body. So the whole journey that I've done from my master's to my PhD, it encompasses about half the whole process of drug discovery, and the of plant-derived natural products. And this is where it takes me to today. Like, what did I learn from researching about cancer? Okay, so there are a lot of factors that are being studied, and throughout this process, we always heard about carcinogens, we heard about family history, but how much of it contribute to the development of cancer? I think you can see here the percentage, okay, in front of you. This was the turning point for me when these statistics sink in. Okay, do you know that only 5 to 10% of the causes of cancer are linked to inherited family history? And 90 to 95% of the causes of cancer can be linked to environmental factors that can potentially be preventable. So this is where we are going to cover today. And here's a breakdown of where this 90 to 95% can come from. Okay, majority of it still is attributed to tobacco. And I think we have seen a lot of efforts onto helping people to quit smoking and to overcome tobacco addiction. And then the next major factor, if you are not aware, is actually excess weight and obesity, followed by diet. Okay, so this constitute about, let's say, 25%. And this is where today we have Vincent to share with us about how we can tackle this factor of excess weight, obesity, and diet control. And then the next, following that, okay, we have lack of exercise, okay, occupation, and so on. Okay, and this is where again we have Vincent with us, who is going to cover not just about exercise, because he's going to go deeper into movement. And I'm not going to steal the limelight from him, but he will explain further about what is the significance of movement, and he can share more with you about even overcoming addiction, maybe a snippet of some of what he knows about it, because we had a discussion recently and it was about 2 hours, and today we want to have an introduction, so we won't go in depth, but the topics that we're going to cover today, as you can see, already will be more than 60% of what is potentially preventable factors. And for myself, I am very passionate on things that are more physical in our environment that are affecting us, okay, such as the carcinogens that are coming from, for example, the UV radiation, and then the products we are using, the ingredients in our food. I've been spending a lot of time on identifying possible carcinogens, or maybe they are not carcinogens, which means cancer causing agents, but they can be ingredients or substances that can be harmful to our health. Okay, before I go on to all these different factors, let me define what is the scientific definition of cancer. Okay, it's defined as an abnormal cell growth with the potential to invade other parts of the body. It is caused by mutations in the gene. And what are the cancer causing agents? Okay, it can be chemical, such as some natural and synthetic compounds. And it can be coming from physical factors, such as X-ray, UV light. It can even be biological factors, like the human papillomavirus, the HPV. And there are a lot of indications that our lifestyle, for example, stress, okay, can impact the recovery journey of the cancer patient. So I wouldn't say stress causes cancer because we don't have that causal link. But for someone having cancer, trying to overcome cancer or live with cancer, stress is a very big factor. Okay, and stress is an emotional factor. So emotional factor is something that, you know, the the environment, the society around us, we are getting more into understanding emotional factors in our life. And I will just cover very briefly about the treatments that are available for cancer right now, but I wouldn't go in depth because I have not been in a clinical setting. Mine is more on the research setting. Okay, so what we have conventionally in the hospitals, okay, the treatment modalities that have been researched on, okay, commonly you will hear chemotherapy, radiotherapy, and surgery. Okay, if we want to go in depth, there's a lot of things that we can discuss about the benefits as well as the disadvantages of these conventional treatments. Okay, and now we have novel treatments that are being developed, such as immunotherapy, which is using components of the immune system, as well as targeted therapy, where they identify what are the specific cause of this particular person's cancer, so that they can receive a very targeted treatment specific for the cause. Okay. So again, I wouldn't go in depth into this, but this is just some things that you can be aware of. I got very interested in this when I started being pregnant with my first child. And at that time, I was still working in the cancer lab, okay, completing my PhD. And when I happily announced to my colleague that I was pregnant, one of the first questions she asked me, Mariam, are you wearing double gloves? And I was shocked, like, okay. um, and then, it's like I start to read all the ingredients, or all the, we call it MSDS, of the chemicals that I've been working on in the lab. And more than 50% of them are carcinogenic or teratogenic. From there, I decided to read more about what are in the environment that I'm putting on myself today. And over the years, I've read a lot about things that we commonly use, okay, such as fabric softener, air freshener. Okay, not all these can be linked to cancer, but they can have a detrimental effect on our health. Okay, if you want to listen more about this, okay, I have a video on the hidden enemy. I will put the link in the description of this video later. Okay. And yeah, this is also in the video where I talk about how processed food can be linked to autism. And personal care, such as even children makeup. Okay, if we say children makeup, then not to mention even adults makeup can be containing asbestos, which is a known carcinogen. I'm just giving a very brief introduction. There's a lot more that we're going to learn today from Huisin and Vincent. So I'm going to hand over the next section. And before we do that, I'm going to do a brief introduction. And here we have Miss Wong Huisin. Okay, she is a senior clinical dietitian with more than 10 years of experience working in various hospitals. Okay, Huisin has outstanding dietetic knowledge in specific clinical areas, including weight management, diabetes, rehabilitation, cancer, kidney disease, and digestive issues in adults. Okay, Huisin founded HealthierU to empower people with the right nutritional knowledge to take better diet and lead a healthy lifestyle so that they can live longer, fuller, and healthier lives. Okay, Huisin has helped many cancer patients to fight weight loss and improve their nutrition status during the cancer journey to enhance treatment outcome and eventually the survival rate. So today we are very honored to have with us to share with you what is the role of nutrition in cancer care. So take it away, Huisin.
Thank you, Dr. Mariam, for the kind introduction. So, hi everyone, I'm Huisin, the founder of HealthierU. So, you have actually learned about what are the causes of cancer, and I think Dr. Mariam actually talked about the chemicals in our products that we use every day, and as well as actually in the food. So, I'll be actually sharing a little bit more about diet-related factors that increases the cancer risk. So as Dr. Mariam mentioned, excess weight actually is one of the risk factors, and also followed by alcohol intake as well as poor diet. So we will take a look into that. So why weight matters? Being overweight or obesity, it increases your risk of getting various diseases such as sleep apnea, fatty liver, gallstones, osteoarthritis, gout, or even the three highs: high blood sugar, high blood pressure, and high blood cholesterol. So besides that, being overweight or obesity, it increases our risk of getting cancers as well, including breast cancer, uterus, cervix, colon, esophagus, pancreas, kidney, as well as prostate cancers. So what do we use actually as a health risk indicators? Usually we will look at the body mass index. So how do we get our BMI? So you can actually divide your weight in kg by height in meter 2 times, and you will get a value. If you are actually within that healthy BMI range of 18.5 to 22.9, you are at low risk of getting all these diseases. Whereas when your BMI goes higher, between 23 to 27.4, you are at moderate risk of getting these diseases. And when your BMI actually even go above 27.5, you are at high risk of getting these diseases. So yes, we know that actually weight increases the cancer risk. And how do we manage our weight? And what is actually the best weight loss diet? Is it a low carb, low calorie diet? Is it by actually probably doing this intermittent fasting, you can lose weight easily? Or most popular or more commonly right now is the ketogenic diet. People want to go on a high fat diet and very low carb diet. Are all these diets helping you? For me, a weight loss diet is actually very individualized. So I help clients actually to look into their daily intake and also their lifestyle and see what are the exact factors that causes this probably excessive intake of the energy intake. All right, so the math of weight loss is very simple. When we eat lesser and we use actually a bit more energy, that actually causes the deficit in terms of the energy and leading to weight loss. So how can we actually probably eat lesser? There are many actually ways to do it, and later on I'm sure Vincent will also share a little bit on the coping mechanism. When we are stressed, we probably tend to think of food and all this, but there are ways actually that we could actually divert our attention towards this food. Of course, not just the eating itself, there are many other factors, including our genes, as well as or biological, like certain people on probably medications that could cause this weight gain as well. So we have to look into actually the whole profile of the clients and look at what are the ways that we can actually help them to achieve the weight loss. So besides weight, we will also probably be looking at like the alcohol drinking. So if you do drink, what is actually the moderate drinking? So a standard drink is about a can of the regular beer with 5% of alcohol, or about 100 ml or half a glass of wine with 50% of alcohol content, or a shot, 30 ml of the spirits with 40% of the alcohol content. And for women, we are actually recommending 1 drink or lesser in a day. For men, will be 2 drinks or lesser in a day. So because studies or previously Dr. Maria has shown that alcohol drinking actually increases the risk of cancer. And besides alcohol, so we also actually look into other nutritional factors that increase our cancer risk, such as by taking more than 50 grams of the processed meat daily. So this has actually been shown to cause cancer, as well as exposure to aflatoxin in the moldy peanuts, and the intake of the Chinese style salted fish intake that can increases actually the we call it as a nasopharyngeal cancer. However, red meat, there is not like a very strong evidence, but by taking 100 grams of red meat daily, which is about a palm size much, could increase your risk of getting colorectal cancer. So these are some of the nutritional factors that can increase our cancer risk. So how does nutrition play a role in cancer prevention, cancer treatment, as well as actually cancer survivorship? So we talk about the risk factors. When we talk about we want to prevent the cancer, we have to minimize all these risk factors. So if let's say you are overweight or you are taking processed meat daily, this is why you should actually think of making some diet changes. So by eating a healthy balanced diet, focusing more on whole grains, fruits, vegetables, that actually can help us to prevent from getting cancer. Once you are diagnosed with cancer, it could be people, I've seen clients like they are eating very healthy, maybe because of the genetically factors that predispose them actually to these cancers. So eventually, actually, I met them in the hospital when they are undergoing treatment. So a lot of times, all these cancer treatments causes a lot of side effects like nausea, vomiting, diarrhea, that reduces actually their overall calorie intake or energy intake and leading to weight loss. This is how actually I help the clients to improve their nutrition by various methods. It could be actually by using some high energy formulas, or even like some of the tips to how to increase the energy intake in their food, in probably their usual food, but because of the loss of appetite, they couldn't eat so much. That's where we could actually add in healthy oils in it to help them to boost the calorie intake. So when they have finished the treatment and we are talking about like survivorship, how to prevent the cancer from recurring. So this is why they should actually also going for this healthy balanced diet, emphasize on more whole grains, fruits and vegetables, lesser red meat in the diet as well. Okay, so in your mind, you might have a lot of questions related to diet on actually this topic, cancer. So whether is alkaline diet good, or is does sugar actually feed our cancer cells, or should I be going actually on a vegan diet so that I will not get cancer, or so that I will not actually have a cancer recurrence? So, and besides that, what are the herbal products, or what are the probably supplements that could actually help in cancer prevention? I don't really have much time to talk about it this time around, but of course, we have actually like workshops for you to attend so that you can know more about this regarding the diet. So without further ado, I would like to invite our next speaker, who is Vincent. Let me just stop sharing my screen first. Okay, so Vincent actually is the Singapore's only certified movement analyst and registered somatic movement educator and therapist. With over 20 years of international experience, he has actually helped more than 18,000 of people from over 30 countries with overcoming chronic issues, healing, and learning blocks. He's the author of Flow, the Art of Creating Abundance, and was a presenter at Harvard University Neuroscience Conference. Vincent sits on the International Association of Dance, Medicine, and Science Task Force for intersectionality in worldwide dance practices. Valuing the importance of healing and growth, Vincent founded Danspire International for his clients and students to experience healing and growth. And he actually did a lot of amazing work in movements, teaching you how to move appropriately and to actually overcome some of actually the chronic pain. So without further ado, I would like to invite Vincent to talk about how do we actually overcome the stress, as well as actually how do we move our body to reduce or probably reduce our stress, as well as actually to have a better mental health, so that we could also reduce our risk of cancer. Over to you, Vincent.
Thank you, Hui Xin. If you can stop share, then I can share. Thank you so much. Thank you so much. Um, Very good morning, ladies and gentlemen who is tuning in right now. Now, just going to get my slides up so that I can present it from the start. Okay, so thank you for today and welcome to Remove Cancer. So how do we remove cancer, right? I think this is a very important idea to actually pay attention to because what you don't remove in your life stays, whether they are the good things or the bad things. So this is something to actually pay attention to as well. So as we have heard from Dr. Mariam, I like to call her Doc M, yes, and then Hui Xin, you know, when we are stressed, stress actually causes tension in our bodies, right? And a lot of people just let it pass, okay, just tension, whatever, and then they continue to work, they keep pushing themselves, and then eventually they get into a state of pain, right? And then the pain will lead to injury, and then of course the injury would lead to disease, right? And if you are diseased for a very long time, a lot of things starts happening. So what happens when we are stressful? There's so many things I can tell you about it. There will be like a whole chapter on its own. But today I'm just going to give you the broad strokes. So we know there's this chemical component. We know smoke actually is not good for us. It's causing all this cancer. We've shared, the uh, sugar intake, right? Alcohol, red meat, yeah, obesity, right? Of course, your environment, right? If it's heavily polluted, it also causes uh, cancer. And then, of course, where you stay and what kind of air do you breathe in, etc. There's so many factors that contribute to it. But do we know that all these things are the causes? But for every cause, there is a reason. So all these things that we are resorting ourselves to is actually a sense of coping mechanism. For example, why do we pick up the next cigarette when we are stressed? Do we know why? Probably didn't think about that, right? You just think I'm stressed and therefore I need to smoke. Okay. It's because the choices we have that we take that causes us, to go forth in picking up that cigarette, for example, or binge eating on amazing steaks, right? And I think everything is supposed to be done in balance. So when we come to talk about choices, we also want to talk about what are the options that are available to us. When we do not understand what the options are available to us, right? We just choose anything that is closest to us because the easiest reach. And this is how we plan our lives. The next packet of potato chips that's hiding in your cabinet and it's there, you're gonna reach for it when you're stressed, right? So besides knowing what causes cancer, we also have to know why we are coping, with all this mechanism which actually leads to cancer. So if you think about it, they're all connected. It's like the thread of this thing that I'm holding, right? The ends of this thread is directly related to the other end of this one. They may be of different colors, but because they're in the same fabric, they're all connected. And it's very important to know the interconnections. And that's why we are here today to talk about, the science of the cells, the diet part, as well as the movement part. And like all good research, there's quantitative research and there's qualitative ones. So what you've seen just now, you've seen numbers and statistics. What about the quality? So this is where I come in. So ladies and gentlemen, can I just invite you without doing anything, just sitting and pay attention to your body right now. Good. What do you feel? You don't have to tell me because I can't hear. But it's more important that you are hearing yourself. How are you sitting right now? Beautiful. Just pay attention to it. And how are you breathing right now? Is your breathing shallow? Are you like semi-focused on, the PowerPoint, or are you somewhat distracted by what's happening around you? Where are you right now? And what got you here? And what if I say to you, are you able to send the crown up towards the ceiling right now? Did you feel the spine lengthen? Good. Which means there is space, isn't it? What if I say, are you able to broaden your chest? If you just be with me here, take all your 8 fingers, you can leave the thumbs alone. right? And just scrape out to the side. Allow the shoulders to melt. And just pause here for a second. What is your body saying to you? Beautiful, beautiful. I know you're doing that. And even if you're not, you're probably like, okay, I think this guy is saying something. When the chest actually widens, when the spine actually lengthens, there is a reason. Now, question is, why do we do this when we can actually do that? Why is why are our choices so limited? You know, instead of expanding, right? If you can see here, maybe it's better this way. Instead of expanding, it's actually contracted. When we can lengthen, instead of lengthening, we are shortening. When we can widen, we are actually narrowing. What is causing all that? And that means there are issues, that we are facing. It could be physical, it could be mental, right? It could be emotional. But until a good analysis is done, jumping to the conclusion is what we can do very quickly. But I don't want to do things quickly. I want to do things justly, and it's for you. So, what can somatic movement do? By slowing down and observing, we can find ourselves calmer, we can clarify our thoughts, we can relax our muscular tensions, and we can really connect and ground ourselves. And then we can heal. So whether you are thinking of preventative measures, whether you are in the process or whether it is post, yeah, you're going on a remission process, it is really important to embark on this journey. So how can somatic movement help, right? We can start to discover, right, our tendencies and our inclinations. We can also uncover the reasons why. And more importantly, we can recover from the traumatic incident that actually led us to pick up the next stick of smoke, whatever that thing is called. I don't smoke, so I don't know. Yeah, the cigarette, yes. And then you have the next potato chips. A lot of things happen to us very unconsciously. So if we can actually consciously look at them, we understand the inclination and the biases that led us there to the first place. And this is where we can peel off those traumatic incidents that happened and it's been layered until a point where we adapted and we think there's nothing wrong with us. I'm not saying that there's something wrong with us, of all of us, but there's always something we are feeling challenged about, don't we? So it's really important to give ourselves that space to grow better, to heal better, so that we can do more in our life. Because if it's not this lifetime, then when? And why is somatic movement so beneficial? Number one, it helps you to relieve stress. Number two, because you are able to release the tension that is inside of you. It's practical skills that you can actually, access. And of course, you can relax the pain. It's not that pain is holding you back. It's actually you that's holding the pain, right? And how do you regulate your emotions is really important. So somatic movement can help you with that and recognizing the real root cause. Okay, so it's like a hourglass. You think about it. There's a lot of factors that contributes to the roots, which is the bottleneck, and then it expands out into the bottom half of that hourglass, which is the multiple factors that causes the problem. So we want to pay attention to that as well, right? And rewiring your habits. What if you're able to rewire your habits? And that means you don't have to pick up the next cigarette or the next potato chips or binge eating or keep drinking, maybe because there was a heartache that you experienced so many years ago and you haven't found a resolution or a reconciliation within yourself. And of course, when you're able to restore and heal, wow, what price would you pay for that? Just have an imagination. Yeah, just imagine. And I think one of the most important thing that I want to share is that if we are able to realize why it is so hard to sustain a good habit, right? And why is it so hard to sustain a good habit, and why is it so hard to kick a bad one? Okay, this is something where we can really pay attention to how we can overcome a lot of things. Okay, we can make things easier. So with the background of more than 20 years in movement, being a presenter and, having helped people from over 30 countries, this other certification, I basically want to share with you, and you can actually, there's a QR code right at the left bottom corner. You can actually do a screen um, shot, or I don't know if you use QR code. You can actually find out more and connect with me. right? And these are the people I've worked with and presented for. But I think the most important thing is really to ask yourself, what is worth for you to have the ability to sustain a good habit and kick bad one with ease? So if you're keen to go on this journey, the three of us here, we bring you through, you know. If we are not hand holding you, trust me, we are heart holding you. And this is a process where, you know, each and every one of us, like we have our individual conversations. I can say that, you know, we connect on very deep levels of, you know, from knowing each other as professionals in the field to, you know, maybe forging a deeper friendship. And at the same time, we also want to forge this comradeship with each and every one of you that is watching this video. Because when you have the access, you can change the world. Thank you very much.
Thank you so much, Vincent. And yes, that bring us back to what Vincent was saying, that we're going to have a program that the three of us are going to conduct. And this is going to be a cancer care part one, where we are going to go more in depth to give you skills and strategies to cope with the different things that you're experiencing post cancer treatment or during the cancer treatment. And so we will be giving you the skills to identify the carcinogens in the environment, because if you do not remove those carcinogens, then you know it can impact if you can get a relapse, or you know how fast can you recover if you keep exposing yourself again and again to the same carcinogen. Then can you imagine how difficult it is for the body to keep overcoming this again and again? Okay, and also we're going to have a section where we will give you the skills on how to manage the cancer treatment related side effects. Okay, such as the weight loss, vomiting, tiredness, and also there will be a section where you'll be taught the skills and techniques for tension release, for pain relief, and how to slip into sleep. Is there anything else that Huisin or Vincent would you like to add?
If you would want to actually know about, yeah, not just like the side effects, the treatment, yeah, related side effects, so you would want to actually know how to actually manage your weight, and you want to prevent actually cancer from, yeah, happening. So this is where you can actually reach out to us and then to find out more about it.
I just want to add on that the work that we are doing here is very lifestyle based. So whether you are thinking about, you know, some particular disease or, you know, the manner where you handle yourself every single day, I think this is where we come in to give you, you know, perhaps some professional intake or professional take on why you shouldn't be going on that path and why you should be going on this particular one, and we can share with you. And it's more like a conversation, actually, in my opinion. For any professional work, you know, especially when it's evidence-based practice, right? You want to understand what the client is thinking, right? You also want to understand the science approach. And then you also want to understand what is the clinical setup like? How is it, you know, helping you in that right connection? When you're able to do that for yourself, then you can make the decisions every single day to empower yourself and actually regain your accountability for your own life, because health is yours, it's not mine, right? My health is mine. So if we can pay attention to all of those things, no, I guess we make better decisions every day, don't we? Yeah.
Yeah. Okay. Yeah, thank you so much. So again, I would like to wrap up everything and say thank you to Huisin and thank you to Vincent for being with us today. And I'm
Thank
really
you, Dr.
happy.
Maria.
Thank you. And thank you to all the audience who have joined us live or who are going to watch the recording later. Okay. So I hope that this session has been beneficial. And, you know, welcome to subscribe to the channel, because we will have more videos on health, and also do check out the Eventbrite. Okay. So thank you and see you in the next session.